Halloween is about
27. We don't know.
Somewhere in there. All right.
No, we do know. Today's October 1st. It's 31 days. 31. Halloween's on the 31st.
Today.
Oh, yeah. 31 minus 1 is just 30. Got it. Okay. But what will Halloween look like this year? Some clever parents are already trying to find a safer way to celebrate. Like this dad in Cincinnati who created a 6-foot candy chute to share treats while social distancing.
That's great. You put your little bag underneath the chute. All right. So how in the world are we going to do Halloween safely? Well, NBC's medical contributor, Dr. Natalie Azar, has some advice. So, Dr. Natalie, first of all, hey. So we know some cities have said no to trick-or-treating. So how do you even begin to know if trick-or-treating is okay in your city or neighborhood?
I know. Well, it doesn't appear that there's going to be one-stop shopping for all of this information. The producers and I were trying to sort of, Google and see how much we could find out, perhaps in our own areas. I think what's going to happen is that you're going to see that states are going to leave the guidance up to cities and localities. And as we get closer to Halloween, I would recommend refreshing your search at your state Department of Public Health website to kind of figure out what's going on in your area and what kind of guidance is being given.
Okay, so one thing that the CDC did do was they put all of these fall activities into these categories. So let's start off with the highest risk activities or the higher risk activities.
Yeah. Okay, so CDC ranked them as high risk, moderate risk, and low risk. And I know this, hit the news a week ago. They do classify traditional trick-or-treating and trunk or treating as an activity that's high risk and something to avoid. They also, and I think the theme of this is indoors versus outdoors. They also say that indoor parties, going to a crowded haunted house, being in a hayride or a tractor ride with people outside of your family is a higher risk activity. Then they gave us moderate risk, and here you can see how the theme immediately goes to outside. And apropos the dad with the chute, this is a great idea, and I think this is a really nice, flexible alternative. Leave little goodie bags or individually wrapped candy at the end of the driveway instead of having all the kids reaching into the bucket at the same time, for example. And then all these outdoor activities that you can do, a small parade, you can do, you can go to a pumpkin patch, you can do a movie night outside. Those kinds of things are considered less risky than the classic.
We're going to keep all right, so we're going to get to the low risk in a second and get your assessment overall coming up. So stick around. More Halloween advice from Dr. Azar coming up after this. We are back with NBC's medical contributor, Dr. Natalie Azar, who's helping us celebrate Halloween safely. And Dr. Natalie, we were talking about moderate risk, and we're talking about kids going to pumpkin patches. Some kids go to those apple orchards and pick apples. I know they have their rules there, but do you think overall that's kind of a safe place to take your kid?
You know what? I do. You guys, I think what a lot of infectious disease specialists have responded to these CDC guidelines, and we've talked a lot about this. What's the major way that this is transmitted? Well, it's through respiratory droplets and aerosol. That really means people congregating, in close quarters and breathing and talking and sneezing and coughing on each other. It's not that contact can't be a mode of transmission, but it's not thought to be the greatest one. So we think about that traditional trick-or-treating with, touching something, opening it up and eating. I don't think we want kids to be doing that quite like that. But if you're out in an orchard, right, and you're separated by, 5 to 6 feet, I think you're going to be okay. And that's why CDC says that's a moderate risk.
You're wearing masks. Okay, let's get to lower risk activities, because this is what I think a lot of people are going to want to do.
Well, so look, the lowest risk activities are really going to involve activities that you can do with your family. So you can certainly do carving pumpkins at home. You can do a household movie night. But you can also do an outdoor scavenger hunt around the neighborhood as long as you're staying kind of distant. And then the virtual costume contest. We're doing everything else digitally and virtually, so why not that? That's another idea.
I liked what you said in the moderate risk, too, like the parade down your street. If you could get all the kids, pick a time, so at least everyone could see everybody's costume, and you could do that in a safe way.
Because that's really the fun of it, right? And even for parents, like, you want to get your kids dressed up. That's, I started enjoying Halloween so much more when I had kids, right? Because it's such an enjoyable thing to do, and I think we can still do that safely.
I think some people might think, well, I have a mask on because of my costume. Do I need to wear a mask?
Mask. So I think a Halloween mask can double as a face covering as long as it fills the criteria that we want it to fill. And that is that it should be cloth and it should be 2 layers and it should cover your nose and your mouth and not have any gaps. What we don't want is people doing like, you know, a plastic Frankenstein face or something and have that be their mask.
Okay.
But it's also important that people understand that you don't want to wear a cloth covering and then you put the plastic mask on top of that, because that could definitely, you know, restrict your breathing a little bit and compromise that.
Oh, that's good to know.
Okay, so we love that clever dad from Cincinnati. Should we all be coming up with tricks?
I like the candy shoot.
I mean, I think one thing you could do is give raisins, because then nobody's going to be pushing their hands into the basket.
And no one's going to, and no one will take it at the end of your driveway. Pick up all your candy.
I'm always worried if you leave it at the end of the driveway, somebody will take it all.
Yeah.
I know. I feel bad. The older kids will potentially steal them, right? But no, I don't think that we all need to go out and make that contraption the way the dad did. But the thing about it that matches what the CDC is saying is that you don't want everybody storming the bucket of candy and reaching in, and then they're breathing on each other. And if you're handing out the candy yourself, like directly from you to another child, that might make people uncomfortable. So the shoot is kind of like a surrogate for having a little bit of distance at your house from where you are offering your candy.
All right, Dr. Natalie, thank you so much.